Yuan, we were talking about the slippery slope concerns around medical assistance in dying. I wonder, and you mentioned that we're sliding down that slope already. I wonder if you could give us a few examples of situations where you see us sliding down that slope.
Yes. I mean, we have had, especially this year, a very alarming number of media reports of people committing suicide through MAID for reasons which I think most Canadians would find actually quite shocking. One major example of this is the number of disabled Canadians who are choosing MAID. Now, those are disabled Canadians, but they are not suffering from a terminal illness. They are not going to die anytime soon naturally, and in many cases, they actually want to live. But what happens essentially that our welfare regime for disabled Canadians is so essentially so cheap in terms of how much support it provides to them, that people simply haven't been unable or have felt unable to live on what they have by way of income. So for instance, in Ontario, the disability allowance is something like $1,200 per month, which is not sufficient to live on in most of the province. And we have had many examples of people who have committed suicide through MAID saying, "I'm simply too poor to live." Now, but poverty is not only the only example here. For instance, only today, the Globe and Mail had an article about cancer treatment in British Columbia. So in British Columbia, the waiting lists for cancer treatment, for basic chemotherapy and so on, are so long that many cancer patients who are suffering, obviously, from cancer and who are unable to obtain medical services in time are actually preferring to choose MAID because they have the choice between suffering physical pain for months or years whilst waiting for treatment on the one hand, or on the other hand, they can get MAID in 2 or 3 days. So many of them prefer to avoid the pain which comes from the waiting list by having recourse to MAID. Even though their conditions are actually treatable and sometimes curable. So again, here, those things are happening in Canada because we have a very, very liberal set criterion for access to MAID. You do not need to be terminally ill. You only need to have a condition which is irremediable, and that could be anything. That could be arthritis, that could be allergies. People have been killing themselves because they have allergies and could not obtain adequate social housing. Now, I think most Canadians, if you told them in 2015 that we would be living in a country where having allergy can be a death sentence, they would be pretty shocked. And yet, because of the Supreme Court and because of Parliament's decision to enact a very broad sweeping MAID legal regime, that is where we are today as a country.
Yeah, and so from the examples you're giving, it sounds like the yardstick has moved from an illness, a terminal illness, something from which a person will die of anyway, to any situation where someone is experiencing severe hardship, severe pain, and justifying it on similar grounds, saying, well, yeah, I may not die of this technically, but it is so difficult and so painful. Who are we to judge these people who might wish to relieve themselves of it? And because of the liberalness of the law, as you say, people can actually access this, for example, if they can't find a place to live.
Yes. And of course, one has the ultimate sympathy for people who make this choice. They are in very difficult situations, and situations which we need to emphasize are not of their own choosing. But in a way, it's a worry here that really we have a healthcare system and a social care system which are not fit for purpose. And from a certain bureaucratic point of view, it is actually much easier, much more convenient for those people who have a very demanding healthcare or social care needs to simply die off, and in a way it becomes this sort of informal way of alleviating pressures in our healthcare system.
Yeah, I think a lot of people would find that troubling, that using, I don't think anyone envisioned MAID as a cost savings tool, but you're saying essentially that's what is turning out to be if people who would otherwise be expensive to help keep alive are choosing to kill themselves.
Absolutely, and the Parliamentary Budget Office actually published a report he made a few years ago where he did the costings for MAID. So as it turns out, it's very cheap to kill someone. It only costs something like 2,500 Canadian dollars per MAID referral from referral to death, whereas obviously chronic care can cost millions over a lifetime. So from a bean counting numbers point of view, it is actually a no-brainer.